my PowerPoints in looking at MRI images of the knee, and this will help with your homework. When you're looking at this coronal plane, okay, and as we page through here, well, our MRIs, we start in this, normally we scan posterior to anterior, okay? So in this posterior aspect of the knee is where you're seeing these muscles. We have this gastroc muscle. Remember, there's like two muscles. You have the lateral head and the medial head here, okay? As we come anterior, and once I see my fibula, I know that's the lateral aspect of the knee, right? In your homework, though, you really only have one picture of the coronal plane, so it's not like you can page back and forth. In MRI, when you're looking at the femur bone as it makes up the knee joint, notice this makes a tunnel, okay? Can you kind of visualize that there's an x-ray that we take that we call the tunnel view? It's really where this ACL and PCL cross. When you see the structure that attaches here to this tibial plateau, the tendon that comes straight down, because we are now looking at, in a coronal plane, we're looking straight on at the knee. If you see this structure that attaches here, that's your ACL. This other dark structure along this tunnel is your PCL. So therefore, if it's my PCL here and my ACL here and not even being able to see my fibular bone, I know that the ACL will always lie lateral in that tunnel. It'll always lie along that lateral aspect. Your PCL will always lie along the medial aspect of the tunnel. Does that help with your homework?
No, which is ACL and which is
Your ACL, if this is my tunnel, this would be my ACL, this is my PCL. If I go a page or a slice more anterior, again, here's my tunnel. I see a tendon coming straight down, okay, and then I see just almost like it's cutting it off on end. That's my PCL. This is my ACL, and I know my ACL is always lateral, so I know then this has to be my lateral, part of my lateral collateral ligament here.
The ACL is the dark band
The dark
that's
band.
kind of curving down,
Yes,
and it's going to be lateral.
it's always going to be lateral. Yep. Now, does this have a knee? Okay, this doesn't have an axial knee, but I'll pull up an axial knee for you. Let's now go to my sagittal series of the knee. Okay? So we're going to start on this outer edge image, and then we're going to scan all the way to the other side of the knee, right? So if I'm starting here, here's my patella, right? So now I'm going to be slicing. Each of these are a slice. Once I get to the center part of my knee, the very first major ligament here is my ACL. It attaches to from the back of the femur to anterior, right? And then if I do a couple more slices, back of femur to the back of the tibia is my PCL. I'm going to go back here. So if I start here with my first slice, I'm going to slice, second slice, 3, 4, 5, 6, 7, 8, 9. If I see my ACL first, am I slicing lateral to medial or medial to lateral? Right, it's lateral to medial because I see my ACL. I keep going and I go to the medial aspect, now I'm seeing my PCL. Okay? Notice then, once I get to the outer edges, past the center of my sagittal knee, I can start to see my meniscus, right? So when you see this meniscus and I don't see any patella, I am assuming this is going to be the medial aspect. Because if I go back to the beginning, and once I see my patella, these menisci are going to be my lateral menisci. Okay? So that's the tricks where you want to, decipher, am I looking at lateral or medial? Do I see my patella? My patella should be more lateral than how I'm slicing through the knee. If I see my patella and I'm looking at the bow tie appearance here, right, because this looks like a bow tie, that's my lateral aspect. As I slice through and I see my bow tie here, that's my medial menisci. Does that make sense? Okay. Let me pull up a axial of the knee, because the very first series, our pulse sequence plane, that we are going to scan are going to be axials. Okay. So once I'm looking, trying to find a good picture here. This would be a perfect picture. Okay. Trying to blow this particular image up. Can you guys see this image pretty clear? Okay. So if I'm looking at this axial image of the knee, and I ask you to circle where is the tunnel at, where would be the tunnel? Right in the center, right? And if I see a ligament, this dark band running along the tunnel, what do you think that ligament is? It's your ACL. So when I see this dark that's running alongside this tunnel, then what do you think this is? Is that lateral or medial? It's lateral. Because when we are setting up our sagittal slices, we're going to be paging through our axials that we took. And then we want to make sure we angle with your lateral condyles, which is here.
Axials on our homework, though, you can't see any type of
Inside,
ligament.
can you see the
They're all like super. I mean, I can see the tunnel in all of them, but they're really blurry. They're like really pixelated out.
Okay.
Maybe I can see one here, but on these two, I definitely can't tell if there is a ligament.
Okay. Now, here's another trick when we're looking at these axials. Your lateral condyle is going to be flattened and straighter. The medial is going to be more rounded. Can you see how this is more flattened and straight? And this is more rounded? This is your lateral condyle. Okay?
Does that work for everybody?
I can tell on these two.
Unless they're like kind of shaped abnormally.
Okay. Looks like this is the straight
See, wait, is this?
That's just right above the tunnel. And I think on this it just says the subpatellar cartilage. Well, we can tell where that's at here. Correct, yes. And we can tell that's where the torn ACL is at.
Yeah, this one, I can't see.
Right.
So I was just pointing out like this is.
Yes.
Okay.
Yep. Yeah. So if I'm looking at a bunch of these different axials here, and if I'm looking at now just this lateral aspect and this medial aspect, can you see how one is straighter and the other one is more rounded. Okay,
Two black things in the middle, those are the cruciate ligaments.
correct, right. So if this is lateral, this has to be, and this has to be correct.
But it looks like the PCL in this one is the one that's running alongside the tunnel.
Right, but you have to also then look at these lateral condyles, because how one knee looks in regards to another knee is the difference of, is that the right knee or the left knee? Okay, because they're going to be opposite each other, okay?
The lateral one on that is right there, okay.
Yes. Over here, the lateral one is over here. Okay? Let's pull up this particular one. What do you think this side would be versus this side? Lateral, medial's rounded. So, you know, anytime you're kind of questioning things, you know, just kind of do some Google searches, pull up some MRI images here. Right off the bat, I can see this is going to be the more flattened surface and this is the more rounded surface. This has to then be your lateral aspect. Here, this is the straight and flattened surface, this is the more rounded. Because you're going to always angle your sagittal images with the lateral condyle. Okay? How about over here? Which side do you think this is? Very good. Over here. What do you think that is? So, you know, as you look at more and more images, how about over here? What do you think is this? Very good. So, you know, the more you look at MRI images, the more things are like, oh, yeah, okay, I can pick that out. How about over here? What do you think this is? That's medial, yes. And, like I said, when we are scanning, we always do our axials first, okay? Because what we do when we get our sagittal localizer, we just make sure we cover above the patella, get through the tibial tuberosity, and we just do straight axials. Once we get that nice axial up, then we can angle our sagittals and coronals, because we can page through those and easily find where the lateral side and medial side is. Now also think about, once you are you're doing your practical, because we are going to slice all the way through that tibial tuberosity, we're going to see the fibular head. So if you really don't feel like you are good at picking out lateral or medial yet, go through all of your axials. You then can see the fibular head. Ah, there's a fibular head. I know that's lateral. Page back up and now you're lateral. Okay? All right, so let's go back